And we are pleased now to be joined by Dr. Keith Collins, an infectious disease specialist with CVPH Medical Center in Plattsburgh. Nice to have you back. Welcome.
Thank you. Appreciate it. Nice to be back.
It's been 3 years, and in many ways, life is starting to get back to normal. But when it comes to COVID, it's not over yet.
We're definitely in a better place than we were 3 years ago. Let me be the first to say that. And I think most of our folks that work in our hospital would also tell you the same thing. We're definitely in a better place. But it is certainly still not over.
And statewide, we're still seeing about 100 deaths a week in New York State.
Exactly. And I think nationally it's still around 3,000 deaths a day. So it's still not over by any means.
And here in the North Country, are we still seeing people getting sick from COVID?
Yes, we are. They're not nearly as many as we were seeing before. The vaccines really do work. And two is people that have already had COVID have some immunity now too. They're both probably at play here. And maybe the third thing is some of the newer variants, although more contagious, may be a little bit milder than some of the original variants. So all three things may be at play here.
Which is reducing the number of deaths. People are
Right.
still getting sick
Yes.
with COVID.
Exactly. And that's even, again, remember, even with the vaccines, they don't really, for the most part, prevent people from getting infected with COVID. They prevent people from being sick with COVID, and particularly very good, even with the newer variants, very, very good at keeping people from getting really sick with COVID, meaning hospitalized with COVID or dying from COVID.
And you talk about vaccinations. Most people here in the North Country have at least one vaccine shot?
You know, I haven't looked lately to see where we are. We were behind quite a bit. I think you're probably right about that, but I don't have the latest statistics in my head. I would like to think that's the case. What we definitely do know, though, is that even though they may not prevent infection, they really do prevent you from getting severely ill. No vaccine is perfect, but as an example, all the COVID vaccines that are being used right now, Moderna and Pfizer, are much better than our annual flu vaccines. So there really is. I think that's a success story that I will actually give the previous administration credit for. They really did Operation Warp Speed and got a vaccine out.
And as you talk about the new variants, though, will pharmaceutical manufacturers have to go back, or are they already back in the lab?
They're already doing it. They're already
trying to see if it
tweaking
needs to be updated?
Right. For instance, the booster that we have right now is what's called a bivalent booster. It has two strains. It also, including the Omicron strain. So, and the nice thing about these newer vaccines and messenger RNA vaccines is they're really fairly easy to change and get a new strain out and chase the strain and get a new vaccine out that is likely to work. In fact, that's one silver lining of COVID is it's opened the door to messenger RNA vaccines being used for many other illnesses.
At the height of COVID, and after the vaccines came out, there, of course, were the mass vaccination site over at the airport. There were clinics set up. Have all of those been scaled back now?
Yes.
And are people primarily going to their own physician to get their shots, going to pharmacies?
Those are the two places. You're exactly right. The thing that I worry about, I know that they're going to be raising the prices of some of these vaccines now that the government is no longer buying them in bulk, and that worries me may be a barrier to some people getting the vaccine. So we'll have to see how that plays out.
And for kids, are they being offered in schools?
Oh, yes, definitely. They've got pretty good data on children that the vaccine works, that the vaccine's effective, and the vaccine is safe. We don't have nearly as many children getting vaccinated as we should. Now that we've sort of made COVID part of people are sort of used to living with COVID, hopefully going forward it will just become more of a routine vaccination for both adults and children.
And for the hospital, is it not nearly the numbers that you saw?
Oh no, it's nowhere near the numbers that we used to see. With a caveat, is that what we see as far as people getting hospitalized because of COVID, that is considerably down. What's not down is seeing people hospitalized for something else that tests positive for COVID. And again, that's probably a sign of the fact that a lot of these people have been vaccinated or they've had it.
And now 3 years into this, are we getting better at treating COVID? We obviously have the vaccines, the booster shots to try to help people reduce the seriousness of it, but are we getting better at treating COVID?
And we definitely are. We're definitely getting better at just supportive treatment, aside from the medicines. We've gotten better at that. But as far as the actual treatments, medical treatments, medicines for COVID, we really have come a long way. We have 2 really good medicines now, one called remdesivir, which we often use in the hospital. The other medicine is one that people have probably heard about, Paxlovid. And that's really been a game changer.
And for the hospital, obviously, early on, this put such a strain on the hospital, on the workforce. There was burnout by healthcare workers. Number of healthcare workers left their jobs and left the industry. Is the healthcare system better handling the effects of COVID?
In some respects, yes. We're not every day is not an emergency like it used to be. There's so many really good nurses and other healthcare workers that retired or left that we never have recovered from, and we're still using what we call traveling nurses way more than we would be comfortable with. And that's, I think, a national problem that everyone is still struggling with, because as a group in the United States and probably other places, a lot of people left healthcare. And we are still not back to where we would, even close to what we were before COVID.
Have we learned a lot of lessons? Are we better prepared for the next pandemic or health crisis that may come along?
I think we are. The main concern I think I have is that, there's going to be another pandemic. Unfortunately, this won't be our last pandemic. When? Who knows? There's no doubt that this virus is continuing to mutate. It's a worldwide virus. It's going to continue to mutate. We are not done with variants yet. I don't think we're going to be done with variants. I think we're going to be in a situation like we are with influenza, where every year we do our best to match the vaccine with the variant. And I think we're getting to that point now where that's what we're going to be looking at, that we're all going to wind up probably getting an annual vaccine for COVID, just like we do for flu, based on the variants that are circulating. I do worry that we could have a variant circulate that becomes more virulent, makes people sicker. That's certainly a possibility. So it still does worry me that we could wind up with a variant out there that could really set us back. Hopefully it won't happen, but that it still exists.
Dr. Keith Collins, thank you very much for taking the time to be with us. We appreciate it.
Thank you. I appreciate it.